Dennis, it's fantastic that you're taking the time here on your set to help us with patient safety. Thank you so much.
Well, I would like to thank everybody for being a part of this and taking their time to be a part of this. And I would especially like to thank Mr. Clinton, who I will always call Mr. President, for being a part of this. It really raises the bar on patient safety and is going to save a lot of lives.
Dennis, this meeting is really exciting in that it's about commitment. Everybody in the audience are being asked to really make a commitment for action, and that's been a passion for you about patient safety.
It certainly has. I mean, the number of people who die each year is just extraordinarily too high, and there needs to be a real commitment to bring these needless deaths down to zero.
As pilots, you and I have always talked about the sweet spot of high performance, both in aviation and in medicine, of leadership, practices, and technologies. That's where the high performance sweet spot is. Your thought about leadership engagement?
Leaders have to make the hard decisions, and sometimes they have to make the quick decisions, and sometimes those decisions go against the grain. But that's what leadership is all about, is taking us into the unknown so that we can make advances.
What's your challenge to leaders?
My challenge to leaders is to invest in patient safety, because they're going to save money and we're going to save lives too.
Your thoughts about best practice in healthcare?
Best practices checklists, for example. Every time I get in an airplane, I have a checklist that I go over, even though I've gone over it 1,000 times. I rarely see this in hospitals. Why not have a checklist in hospitals?
Technology is an area that you and I have had lots of conversations about, is interoperability and how important it is and how we're nowhere there yet.
The interoperability of, you and I have talked so much about CPOE and barcoding and electronic record keeping and being able to really connect all of these and connect these from one hospital to another. It's so important in saving lives.
So the three areas of this conference, the focus areas, are failure to rescue, safe blood management, and medical errors or medication errors. Medication errors is really close to your heart.
Yes, my twins, Thomas and Boone and Zoe, were almost died because of a medication error at a very young age, and it was completely preventable. But thankfully, they're healthy and happy today. And come to find out that the same accident had happened a year before in Indianapolis, that had killed some children, and happened again after the fact of our incident. But that's what brought us together and started us on this quest that we're on.
Failure to rescue is not unlike what you and I run into in the cockpit when we get behind the airplane and we don't catch something early enough that could result in a fatality or a crash. What are your thoughts there? We're still really battling failure to rescue in our hospitals.
That just means paying attention really to problems that come up and catching them so you don't get behind the curve on it. And that's what checklists are all about. And checklists sometimes feel tedious and a little too routine and dull, but they're there for a reason, and that's to catch errors before they happen.
The other area you and I were both surprised about was safe management of blood transfusions and blood products, and I know the kids also had lots of infusions after their accident. Weren't you excited to hear that there's something where we can save lives, save money, no one gets harmed by doing the right thing, and that most people don't know about it?
Yeah, accidents happen in hospitals every day, and it's called human error, and it's anything that we can do to bring down the human error factor is, why not? That's the way I look at it.
Dennis, Joe Chiani and the Massimo team have done a fabulous job pulling this meeting together. Your thanks or comments to them?
This meeting could not have happened without you, and I want to thank you for putting this together, and I know it's going to do great things for patients all around the world.
Great. Thank you, Dennis. You have been so generous with your time to help these leaders that are coming together and challenge them to really move to action. You've always been about action and not just learning and telling the story, and you've lended your celebrity to help save lives, and we're so grateful.
The people here at the conference are the real heroes of the day, because they're the leaders who are going to implement programs and really be down on the ground and make sure that things get done.